everyone, and welcome back to another episode of MedSynapse podcast series. I'm your host, Hetvi Shah, and today we're diving into a topic that resonates deep with healthcare professionals around the globe, which is the challenges of rural healthcare delivery. Despite advancements in medicine, millions living in the rural areas still struggle to access the care they need. And joining me is someone who has first-hand experience addressing these challenges. This is Dr. Christian Fabian. Dr. Eric is a passionate rural health physician and part of the renowned Doctor to the Barriers program in the Philippines. With his expertise in community health and sustainable practices, Dr. Christian is an advocate for healthcare equity. So welcome, Doctor, and thank you for joining us today.
Good evening, ma'am. I am very pleased and I feel very flattered with this invitation for this interview.
Likewise, Doctor, and we're so excited to hear your thoughts on this crucial topic today. So now let's start with your journey, Doctor. So could you share an overview of your experiences working in rural healthcare settings and what have been some of the most significant challenges you have faced in these roles?
I was a scholar of our country's Department of Health since when I was in third year of my medical school until internship and until when I passed our physician licensure exam here in the Philippines. So my deployment as a doctor to the barrio, our Department of Health's flagship program to provide primary healthcare access. This is a return service for my scholarship. So the program means to provide doctors to the farthest corners of our country. So currently, I am already 9 months into my deployment here in Davao Oriental. It is a third class. I am in Boston, a third class municipality in the eastern seaboard of Mindanao, the southern island group of our country. So when someone asks me about experiences, so there are some experiences that stand out. For example, when was it? I think it was a month ago or so that I delivered a baby in the floor of a house because the patient's water already broke, and then the ambulance that was supposed to bring the baby to the birthing facility was still on the way, and then the mother was already giving birth, so I delivered the baby then and there in the house, in the floor of the house in the rural area. So that's a key moment that really stands out when someone asks me of my experiences here.
Yeah, so that is so truly inspiring, Doctor. And also, it is so humbling to hear about the commitment it takes to bring healthcare to undeserved communities, especially. So now, let's just talk about the barriers or the challenges. So what, in your opinion, what are the biggest gaps in healthcare delivery in rural communities today? And are there any trends or recurring issues that stand out?
So basically, being a rural doctor means practicing in the rural areas. So with this regard, foremost, these areas are far from the healthcare. So the distance itself is a very important factor in why these areas tend to be limited in their access to proper healthcare, because our health facilities are logically situated in the cities where there is a funding, and then there is a greater motive for, like, for example, for private companies, and then also most of the population tends to be depending on the country, of course, but in the Philippines case, most of the population is in the urban areas. So there is a tendency for the rural areas to have lesser health facilities. So I think geography is one of the foremost concerns for the most part.
Yes, yes, absolutely. And I think that's such a crucial point that you have mentioned. And bridging those gaps, I feel that would require a multifaceted task as well, that, requires efforts from both,
Yes.
from a multifaceted team also. So now let's just talk about the infrastructure that rural areas have. So rural healthcare facilities often struggle with limited resources and outdated equipments. So what are the primary infrastructure issues you have encountered, and how do they impact the quality of patient care?
In my case here in the rural Philippines, there are a lot of basic facilities that are lacking compared to bigger towns and in the cities. So, for example, ma'am, here in my town in Boston, where I am assigned, we do not have an X-ray machine. We do not have an ECG electrocardiograph machine here, an EKG. We don't have one. Uh, we don't have we don't have a hospital. Even the lowest classification of hospital, an infirmary, according to how the Department of Health of the Philippines classifies hospitals. The nearest hospital is 20 kilometers away, I think. It's around 20 kilometers away from this municipality, and it is only a infirmary level hospital. If you want access to specialists, to specialized care such as for uh, acute myocardial infarction cases, so you're gonna have to refer your patient to the nearest biggest cities. So that's we're talking about around 4 to 5 hours of travel, ma'am, to get our critical patient to critical care specialists.
Oh, that is such a remarkable experience that you shared, and something that is really not believable also. So in such cases when the hospitals are so far, how do you manage the emergency cases where emergency is needed, or emergency looking for a patient is very crucial? So what is your approach in such cases?
So for emergency cases, so we do what we can manage here with the available resources in the locality. But as I've said, there are patients who need more critical care, really need to be referred immediately. So with that, we've developed linkages with the bigger hospitals so that there will be an easier flow of referrals when the need arises. And we make do with the limited resources, given that we're a little town compared to the cities. So we practice. I heard a colleague use the term guerrilla medicine here. So we make use of what's available. For example, if there are patients with fractures, we just use PVC materials, from the pipes, to make temporary splints. Then for the dressings, sometimes we just use cloths that we just put on the autoclave so that they will be sterile. It's not the standard quality dressings. And then aside from making the most of what we have, it is important in our case to have a robust referral system, because there's a reality that our capabilities here are very limited, as we are just a rural health center compared to at least a hospital, an infirmary level hospital to begin with.
Yeah, those challenges are really something that is not really seen in urban areas. So those challenges would be really difficult for you all also to manage at times. So one more challenge that I could think of is, that can stand out is the late diagnosis or lack of follow-up care in rural areas. So could you elaborate on these unique patient care challenges and show how healthcare providers might address them effectively?
So here in the rural part of the Philippines, when I was first deployed here in the barrio, in the rural area, I encountered a crisis of sorts of the local populace having poor health-seeking behaviors. So, for example, if some patients have lower back pains, they immediately start taking antibiotics because they think that they immediately assume that they have urinary tract infections because of their lower back pain symptoms. While on the other hand, these people, some have stopped taking their maintenance medications because they think these maintenance medications have a side effect on their kidneys. So and so these are some of the behaviors that I have encountered here in the rural area when I was first deployed here. So I guess this local poor health-seeking behavior comes from lack of a proper health education of the local populations here.
So, there's so many different aspects to consider also, as you mentioned, like people from their own stops taking the antibiotics and also, right, kind of education, spreading awareness is also equally important, I feel. So now let's pivot to policy for a moment. So if you had the power to enact changes, what policies would you prioritize to support and strengthen rural healthcare delivery systems?
With regards to policy, in our case here in the Philippines, I would like for further national support when it comes to financing, because in our current setup, in our current world, you really gotta have money to finance everything, because if you don't have money, you can't you can't finance programs, and then the programs will not because currently the policy of the health policy of the Philippines is they are currently delegating more and more of the budget to the local government units, so the local governments. So it depends on the local government units to if they have the but sadly it is a reality that the budgets of each local town is different in size. So there might be a town that has more income that is comparable to cities, and then there are small towns that such as where I am deployed that are smaller, and because they're smaller, they have a uh, more smaller budget. So it would be nice if I had the capability to change national policy, that the national government would help in shoring up the budget, especially with smaller towns such as where I am deployed, so that we will have more money to implement national health policies.
Yeah, thank you so much for sharing those thoughtful recommendations. And I think it is so clear that addressing these policy gaps would actually pave the way for sustainable improvements also in the rural healthcare system, especially. So, now finally, for the next generation of healthcare professionals, many are eager to make an impact in rural health but may not know where to start from. So, what advice would you give to those aspiring to follow your footsteps to make a change in the rural areas?
So here in the Philippines, the national government currently offers scholarships for those who want to become doctors, and the payment or the return service for this scholarship is to become a doctor to the barrio, just like me, or a doctor that if they will not serve in a rural town, a rural community, they get to serve in a provincial hospital, which mostly caters to people from the rural areas. So that would be a nice opportunity for those who, like me, would want to serve uh, these people from the rural areas who tend to be socio-economically disadvantaged compared to the patients that we see in the cities, which tend to be of higher socio-economic class. So that would be a good avenue. Also, if they do not want, or they aren't able to join this scholarship, there are there are times that the government offers there are vacant positions available for those who want to become employed as government healthcare workers in the rural areas. And also there are non-private, non-governmental organizations, NGOs, that have projects in several rural areas here in the Philippines and in other countries that can also serve as gateways for those who have the heart to serve those people that need help in accessing basic primary health care.
Yeah. So actually, it also comes from the within that if the doctor really wants to make a change for the rural areas, and these days I think it is a need of the hour to actually do that and make an impact for the rural areas as well. So thank you so much for sharing that with us and the aspiring doctors as well. So as we wrap up today's session, Doctor, thank you so much for sharing your invaluable insights with us today. And let me tell you that your dedication to rural health and your ability to articulate these challenges and solutions is truly commendable. Thank you so much, Doctor.
Thank you also for this wonderful opportunity, ma'am.
Thank you so
I am
much.
very much humbled.
Same here,
And
Doctor. And actually, listening to these insights that you've shared, it was really commendable to hear those as well. So, thank you so much for sharing that. And to our audience, thank you so much for tuning into this episode of MedSynapse podcast series. And remember, if you are a healthcare professional who is eager to delve deeper into medical topics or have questions, do not hesitate to join us on the MedSynapse platform. MedSynapse platform is not just a resource. It's a dynamic space where you can connect with your medical peers, participate in meaningful discussions, and contribute to the ongoing evolution of healthcare. So until we meet again, stay curious and committed to creating a healthier world.